passion, energy, and a man who has dedicated his life and work to his healthcare beliefs. He's all about outcomes, population health, and tomorrow's technology. Award-winning digital health evangelist Brian Ahier is here on Red Hot Healthcare. Let's go!
3 alarm at 21 and north. All engines respond.
This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and welcome to the show. I'm your host, Steve Ambrose, and you can subscribe to Red Hot Healthcare on iTunes, Stitcher, and other podcast directories. And we love to hear from you. Just send your comments or questions to steve@redhothealthcare.com or hit me up on my Twitter handle, PolymathSteve. Today's show is being sponsored by Medisend, any size medical office, facility, or hospital. Let Medisend analyze your current medical waste services and fees. You can remain with your current waste vendor, and Medisend will lower their ongoing fees to you. Medisend gets paid only if you save. Or switch your medical waste services to Medisend. They often save new clients up to 30% or more off current vendors, and fees remain level from year to year. Just go to redhothealthcare.com, fill out a few fields. Guys, I can't do any better than this. Medisend is good people with great intentions. Save with Medisend today. And now, we're ready for the show. Brian Ahier is an award-winning digital evangelist and nationally known expert on health information technology. His core focus is on health data exchange and population health management, working at Medicity, which is part of Aetna. He also sits on the Consumer Technology Task Force, a key recommending body to the ONC HHS and their initiatives. He received the 2016 Digital Health Evangelist Award by Rock Health, Goldman Sachs, Square One Bank, and Fenwick West. He has written numerous articles for a wide variety of industry-leading publications, including Healthcare IT News, Health Data Management, Executive Insights, and O'Reilly Media. Brian, great to have you, and welcome aboard Red Hot Healthcare.
Thanks, Steve. It's good to be here with you.
I know that your job at Aetna, at Medicity, as a part of Aetna, is in working with population health management and data exchange. And I'd like you to tell our audience a bit more about what you do at Medicity and what sort of effect that is having on our healthcare system.
Medicity had been a traditional HIE vendor, one of the top in the country, and sort of reinvented itself prior to the Aetna acquisition to really start focusing on population health management and broadening more than just let's exchange data to really now what useful things can we do with data, which is important, right? I mean, I've always said for about 10 years now that there's sort of 3 paradigms in healthcare and digital technology. The first is capturing the data. As a nation, we've done pretty well with that with EHR adoption, at least in the inpatient setting and physician clinics. And then we're making a lot of strides in the exchange of data and standards development. So now we're sharing data. We're capturing it. We're sharing it. That's number 2. And the third is, use the data, right? And I think the important thing is using the data to improve care at lower costs, sort of the grand idea, stemming from Donald Berwick and Elliot Fisher and others around accountable care and, the triple aim. Medicity Connect is an exchange mechanism, but, it's sort of the low bar, right? We just want to be able to connect folks and send messages, really secure messaging using the direct project protocols. Medicity, billions of transactions every year. This year, breaking records again. The Medicity Exchange enables physicians to place orders from their clinic to hospital services such as lab, radiology, and even rehab services. And then we've got a notification engine. We have Medicity Notify, which can notify providers and care managers, and they can subscribe to real-time notifications whenever their patients are admitted or discharged from a healthcare facility, or certain sentinel events occur, that you can get a notification. And that's really important. And then Organize, which is now we start talking about the analytics capabilities, which is the thing I think I'm most excited about in terms of population health management. Really the analytics capabilities that you can bring to bear when you have this massive data set. And, we'll talk, I'm sure, later about how this data set is growing at exponential rates. So that's sort of what Medicity does. And what I do is support that in any way I can.
As a part of data management, you touched on this with EHR products. Let's talk a little bit about the EHR industry players. And with regard to interoperability, we look at Cerner and GE Healthcare and Allscripts and Epic. Have they been helpful in this transition towards interoperability, Brian, or have they been not so helpful and maybe not willing to be a part of the solution?
We partner with all those that you named, as well as Athena Health and NextGen, all the top EHR vendors. I think that they have great intentions, and in many cases have actually helped really spur the progress around interoperability. Data is actually the currency of the next century. Your data is your most valuable asset. However, it's not a zero-sum game. To think that if I just silo my data, that somehow that is going to provide me a business advantage in the marketplace, it limits your thinking to a great degree, and especially when we move into a value-based world. Now everything's turned on its head. You're not getting paid the same way you used to get paid. You're at risk as a provider, and you expect your vendor to have different capabilities than you expected even 5 years ago, certainly 10 years ago. Now data sharing, the ability to share data across platforms, across organizational entities, and between and among providers and clinicians, that's a business advantage. And if you can't do that, then you're going to find yourself over the next few years really hamstrung and I think unable to thrive. So they've really done a lot. There's the Commonwealth Alliance, Care Equality, which is an initiative of the Sequoia Project, which also the other initiative probably heard of is the eHealth Exchange. Both of those initiatives, provide a lot of connectivity at a national level. The EHR vendors, I think, believe that they have the data, or at least their customers do. They've got their systems have these large data sets, and so they don't need HIEs or anyone else. We have all the data. I've heard leaders in some of those organizations say, we have all the data. So we can do all the data exchange and all the analytics and all the population health management. You don't need any third-party tools. Well, that's short-sighted because you don't have all the data. You really need to be able to share data now because you're getting, if a patient leaves your facility and goes out into the community and then sees a provider over at the other facility has tests done, has something happen to them, and you don't have any idea that that's happened. When you're getting paid for value, when you have a quality reporting that, goes outside the four walls of your organization, you really need to have a more collaborative approach. And I think we're making strides in that area. We've made a lot of progress in standards and being able to do that. And the development of FHIR, which is a new HL7 standard, still under development. And, it's actually making headway. FHIR is FHIR, by the way. It's Fast Healthcare Interoperability Resources. And it's a HL7 specification. So back to your question, I guess, the EHR vendors, I think, have been, for the most part, helpful and willing. Although, they have their master that they serve is their customer. So right. It really depends on the physicians and other clinicians and the health systems themselves. If they start complaining, then the EHR vendors are going to respond. And, I think we're starting to see that now. They are saying what they want, and it's really based on many of them are now, entering into risk sharing arrangements, on the payment side that actually make all this collaboration not just a nice thing, but necessary. And ultimately, what's going to really, when we reach the tipping point of patients, of the consumers with their demands, that's when things will really change.
I get email from listeners that want to know what I do. Hey, I'm a consultant working in 2 areas. First, multi-level consumer engagement. I provide tactics and strategies to direct engagers, such as hospitals, payers, life science, and medical technology companies, and to indirect engagers, companies that sell products, software, and services to the direct engagers. If you haven't created tactics, strategy, and partnering around engagement, don't be surprised when consumers continue to close you off. Second, I'm a heavily connected networker who strives to connect pieces that drive innovation, collaboration, and mutual benefit. Every relationship I carry across multiple healthcare industries is open for contact, conversation, and business. Everything's changing in today's healthcare, and in many ways it's become an unsettling and yet opportunistic Wild West. Reach out to me if your company would like new thought, tactics, and strategy to increase growth and profitability. And now, we're ready for the show. I'd like to get your thoughts on how you see the Trump presidency, the emerging Trump presidency, changing the future, not just with respect to the Affordable Care Act, but also how the next several years of our current health system rolls out.
The good thing here is that we don't have to rely on the magnificent brain of Trump. He's already started to name the people that would really drive forward a new healthcare agenda. The Republicans have control of the House, control of the Senate. They don't have a supermajority in the Senate, so they're somewhat limited in what they can do. But with the nomination of Dr. Price, Congressman Price, who's a physician and knows the healthcare system well from that viewpoint, I think there's obviously going to be a shift in the way that HHS, as a Secretary Price comes in, is going to do things a little bit differently. The repeal and replace the Affordable Care Act, which some people call Obamacare, that will take years to happen. And, now that's starting to come out, and the reports on this that you can't just come in on day one and repeal it, because first off, the Democrats will filibuster that in the Senate. Mm-hmm. You can do a lot of things through budget, and that's what will happen. So a lot of things, parts that, that the Republicans find most egregious, they'll deal with in budget reconciliation. And Congress has felt like they have not really been accountable for all this money, and that there hasn't been congressional oversight on these funds. So that's going to be defunded. The cancer moonshots and precision medicine initiatives, again, those actually are funded within the 21st Century Cures Act. So there will be money for that. I think a lot of things going forward, healthcare and beyond, are going to be privatized in this administration. And that's just the way it is. That's apparently what the American people wanted, because he was elected and he didn't make any bones about it. He was going to come in and change things.
And I think one of the things you mentioned too, Brian, was off air, and you said to me, who is going to be on the Supreme Court? That's going to be another very, very big question that might have some impact on healthcare as well.
Oh, yes, it will certainly have impact on healthcare of all kinds, right? What some people call women's health issues, which what they're really talking about is abortion, birth control type things.
Right.
Just healthcare in general, though. There's going to be other cases that come before the Supreme Court, just like we've had recently, where Chief Justice Roberts actually cast a deciding vote to sort of save the Affordable Care Act. Those cases are still coming forward, actually. You've only got 8 right now. You don't have a tiebreaker. And that 9th justice is going to be really key. And there's likely to be other replacements in the wind over the next few years. So it's long lasting. That's generational in scope and really vitally important.
Brian, I know that you have, like me, a lot of interest in artificial intelligence. I want you to talk to our audience a bit about where you see the key technologies and products that use AI being able to complement not just care coordination and the triple aim, but really also population health too. Where do you see AI coming in, and where do you see it making some tremendous impact moving forward?
There's two things I just want to touch on here. The first is artificial intelligence, which is really machine learning is the prime mover behind a lot of this, right? There's machine learning, and then you've got supervised and unsupervised learning. You've got deep learning. So these machines now can do things, incredible and amazing things, and it's going to have a big impact on healthcare and on every industry, and it already is. When you think about driverless cars, automated processes that normally a human would be doing, but it's sort of a boring, dull, repetitive thing that if a machine can do it faster and better and doesn't get tired and doesn't need to go on vacation, that's a win-win, right? Except for the person who lost their job. So we'll have to deal with all of that in what we call the next economy. And the next economy is not, 50 years from now. The next economy is very close, right? William Gibson said, the future's here. It's just not evenly distributed yet. I always say, well, the future's now, right? When I was a kid, all the whiz-bang, Star Trek, sci-fi stuff that I was into, a lot of that's actually here now. And so artificial intelligence will enable much of that. Just real briefly, the other thing I think that sort of ties into that is a new information technology. I think the biggest new and emerging information technology we've seen since the creation of the World Wide Web, and that's blockchain. And without getting into the details of what blockchain is, people think Bitcoin. Well, yeah, Bitcoin is built on blockchain technologies, but there's all kinds of other uses too. There's smart contracts. Mostly right now, it's used as a distributed ledger type paradigm for financial services, and financial technology outfits are really embracing blockchain. And a lot of the big players are as well. On the vendor side, you've got, IBM, Microsoft, and others that are making blockchain technology available in the cloud. I think there's many use cases for healthcare using blockchain technologies. And we're not talking about, a generation from now. I think the way technology is advancing at the rate we're seeing it now, we're talking things that you would have thought maybe is 10 years from now, compress those timelines down to 3 to 5 years. We're going to see massive change in 3 to 5 years due to blockchain technologies and artificial intelligence capabilities.
When you look at the way technology was introduced during the 80s and the early 90s, and it was introduced almost as a way to augment human productivity, now if we've looked at the productivity, the output per hour per human worker, a lot of people are surprised to know that it's flattened out over the last 3 years. But when I look at AI, I see a natural extrapolation of progression in business, and certainly in having to replace human workers, especially in healthcare. When you're looking at the number one cost in any business, and especially healthcare, is human capacity. When you've got salaries, and you've got people sick, and you've got insurance benefits, and you've got pregnancy and leave, and you've got labor strikes, to replace people whenever and wherever you can with human-run machines, but yet replace as many components as you can with AI that could necessarily make care and diagnosis and care coordination faster, more predictable, better scalable, and more efficient. I just don't see how that doesn't happen. I don't see how jobs are not eventually going to start going by the wayside and getting replaced as just a component of necessary business acumen and dropping costs.
Right. Yeah. And well, so that's, I sort of hinted at that when I talked about the next economy. And certainly automation and artificial intelligence capabilities are going to increase productivity and reduce the need for human workers to do dull, monotonous things. I would say to someone, if a monkey can do your job because you're just picking one thing up and putting it into a cup over here all day long, you got to make sure that the little bead goes in the right cup, and that's all you're doing. That's unskilled labor. We really need skilled laborers. Humans are better than that, right? These machines augment our capabilities. Like you said, with the technologies of the 80s and the 90s, you're going to see that flatlining in productivity over the last few years spike back up now as a result of the capabilities of these machines. And so, whether it's, in the fields of robotics, where you're talking about actually physically replacing a human, or in fields like genetics, information processing, that the human brain just isn't capable of taking that massive amount of data and very quickly making conclusions. We're going to see some people out of work. And so as that occurs, hopefully this next generation, this is why kids out there and parents, I encourage you, really impress this upon your children. Science, math, STEM. These skill sets are incredibly valuable, and they're actually a requirement in the next economy. And so you're not just competing against, the kids in the next county over or the next state over. We're competing on a worldwide basis. And so we've fallen behind, and we really need to step it up and show that America is the best. And we can do that with a well-trained force of scientists and mathematicians. And in particular, I would encourage girls who grow into women scientists, right? I think that's really vitally important. You know what? We could end on this if you'd like, Steve, because I know you probably like the song just as much as I do. And I'll just say, that's right. The women are smarter.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.